Next up, we have Astrid Gyllenkrok Kristensen. She is the co-founder of LEIA. LEIA launched this year. It's a digital guide to help women feel safe, healthy, and informed during their 4th trimester, so just postpartum. And you can't tell, but I'm actually 8.5 months pregnant. So this is going to be really helpful for me. So I really look forward to seeing what you've got to say, Astrid. Welcome.
Congratulations, Anna. I hope what I say won't scare you. Cool. So my name's Astrid Gyllenkrok Kristensen, and I'm joining you from Sweden today. I'm the CEO and co-founder of LEIA, and we're a startup with a mission to redefine postpartum health for women worldwide. And I'm very excited to be here. Also very excited to hear the innovations talked about by Dr. Liv. Pelvic floor disorders is something that a lot of women that we talk to are struggling with. So very happy to hear that we're looking into innovations. So I'm here today to tell you a little bit about Jane. Jane is one of the lucky ones. But 9 out of 10 women giving birth will experience mental and physical difficulties the following year, such as incontinence, prolapse, stool leakage, and postnatal mood disorders, including anxiety and depression, affecting not only them, but their families as well. Suicide is now one of the leading causes of death in new mothers the year after giving birth. And the percentage of men being diagnosed with postpartum depression is on an all-time high. Female health is currently undergoing intense digital disruption. Postpartum care, however, has been left behind with devastating consequences. The last couple of years, we've seen a boom in digital innovation around reproductive health, focusing on fertility, pregnancy, and nursing, as we heard before. But as soon as you give birth, the information, the medical care, and the digital solutions all focus on the child. And as a mother, and also as a co-parent, you're often left to fend for yourself in what is often referred to as one of the most overwhelming and challenging times of your life. And I think everyone here that has children can contest to that. Barriers such as low access to experts, lack of personalized information, and the fact that this is a very stigmatized area means that millions of women are suffering in silence. And as a consequence, the proportions of newly delivered mothers who are being readmitted to hospital are also growing, increasing costs on both healthcare and society. The months following birth are a critical period, setting the stage for long-term health and well-being. To truly optimize recovery, postpartum care should be an ongoing process rather than a single encounter, with services and support tailored to each woman's individual needs. LEIA consists of a team of professionals who have previously led and developed global tech and health tech platforms. But more importantly, we're mothers who have experienced the consequences following the lack of postpartum care. So who are we? Well, my background is in driving digital innovation, business and growth strategies in executive roles for international companies such as CNN, Viaplay, and MTG, as well as previously running a social impact startup. But creating person-centered digital solution has been a common thread throughout my career. Sandra, my co-founder and LEIA's CPO, has a background in working with successful Swedish startups like DanAds and Klarna. And as a previous product owner for Natural Cycles, she has extensive experience in breaking new ground and scaling up services and products in new international markets. Together with our tech and medical advisory boards, consisting of experts and researchers in all areas covering postpartum, we want to build a product to help not only us, but the 140 million women giving birth each year. So our mission is to redefine postpartum health by offering AI-powered support for both mother and partner. So LEIA works as a digital complement to existing healthcare by taking a much more data-driven, prevention-focused, and person-centered approach. We offer personalized and actionable insights to optimize women's post-pregnancy recovery. Based on the data we collect from the users, we'll be able to serve content and rehabilitation exercises from a broad range of experts based on their individual needs. And by creating a community of both experts and other parents, we'll lower the barriers for participation and drive dialogue. Because only by sharing our thoughts, our concerns, and our fears, we'll begin to break down the stigma surrounding the fourth trimester. Because yes, there are four. And to drive real system change, we believe it's important to create value to all stakeholders. And we'll do this by digitalizing medically validated screening models to enable earlier self-detection of postnatal complications, leading to earlier treatment. And by tracking women's recovery and allowing them to share their data with their midwife and their caregiver, will enable a more personalized care. And lastly, by collaborating with key research partners globally across all areas postpartum, we'll be able to apply machine learning and our key algorithm to identify key factors to optimize postpartum health in the future. So let's go back to Jane. Lucky Jane. She thrived in her fourth trimester, but her sister, her friends, and our colleagues might not be as lucky as her. Ahead of this event, me and my co-founder, Sandra, looked back at some of the user research we did early on with LEIA. And we were both astounded to understand and to hear how neglected the mothers felt in their overall process. So the journey for them as new mothers was designed for an existing process, an existing healthcare system. And that's why we're obsessed with their perspective when designing our product and service, because it begins and it ends with their experience. And we strongly believe that if this is done right, it can actually help and improve the information, the insights, and indeed the existing process for the doctors and midwives working in maternity care. Because collaboration is key. And together, we can redefine postpartum health and give all new mothers the support they so rightly deserve. Thank you.
Thank you so much, Astrid. That's fantastic. I can't wait to give it a whirl.